So you can leave. It was, I don't know if I'm explaining it well, but it was, I wanted to give the money so that it could help somebody. But at the same time, it was like admitting that I had lost.
And yet another Oregon woman who'd been begging went to the last hour before being rescued in mid-March, this time by a hospital. San Francisco's Pacific Presbyterian Hospital has started a new liver transplant program and was looking for a first patient. It chose 55-year-old Kay Irwin of Portland.
I just think that it was a gift. And the guy up there, you know, why was I chosen? It's a mystery, but it is just, to me, a miracle. It is to me. I've been a lucky person. I really have.
Can hospitals plug the funding gap left by the legislature? The head of Pacific Presbyterian's transplant program says it's doubtful.
That's not a rational solution because the numbers are too many. In other words, there'll be a lucky few.
A lucky few, and the rest?
Will die. People who need heart transplants and liver transplants who don't get them, by definition, die.
We've got to help ourselves. And there's so many wonderful people out there that you never hear about that are working together. And the politicians, phooey, we'll show them.
Late in March, the state did make a token effort to relieve some of the financial burden on transplant patients. The state says if individuals will raise their own funds and give those funds to the state will use that money to pay for transplants. That state involvement will guarantee federal matching funds and cut a patient's fundraising needs dramatically. But Kay Irwin's son, Craig, who heads a citizen fundraising organization, says even that reduced amount of money will be hard to raise.
What you're doing is you're asking people who are critically ill to go out and be marketing experts, to be creative, and go out and make the money. And that is just a terribly unfair way for people to try to pay for these transplant operations. If you're not pretty, if you're not the adorable baby, then the odds are against you.
As the sad tales of Kobe Howard and David Holliday show, even the adorable baby faces long odds today in Oregon. But experts say Oregon is merely the first state to signal in a new era of health care rationing. There will be other Kobes and Davids elsewhere in the U.S.
People in America better get used to this because there's going to be less and less money for, quote, medical care. And the Mrs. Irwins are dramatic because they need a transplant. But soon, as in other countries, people are going to wait to get their heart fixed. They're going to wait to get their hips fixed. And there's going to be some rationing of medical care.